Hello and welcome to this presentation, which is an overview of the Kansas Head Start Association. This presentation is intended for board members to learn more about the association and their role as they come onto our board. However, others are welcome to watch this since it is a good overview of the association and what we do. My name is Eric Vaughn, and I am the Executive Director of the Kansas Head Start Association. I've been the Executive Director for almost 3 years, but prior to that, I was the Fiscal and Program Manager for almost 2 years at the association. The Kansas Head Start Association is dedicated to strengthening early learning programs through advocacy, education, and leadership. Those three activities, advocacy, education, and leadership, have not changed since the foundation of the association in 1997. As the Kansas Association, we represent all Head Start programs in Kansas, and we create a unified voice and a point of contact for partners as well as policymakers. By doing so, KHSA supports many special projects and initiatives, including health literacy, oral health, financial literacy, advocacy, especially parent advocacy, and other activities. More simply stated, our vision is that Kansas is the best state in the nation in which to raise a family. And our mission is that KHSA supports and strengthens Kansas early learning programs through advocacy, professional development, and leadership. We believe that it is important to share what our values are. That is the basis of the work that we do. The values that I will go through some of them have been in existence from the beginning, the foundation of the association, and others have been added as we have been around for now almost 18 years. And most recently, we have modified and then added a few values through our strategic planning process for our new strategic plan that started in October of 2015. First value is that we believe that parents are their children's first teacher and most important advocates. We value informing and empowering parents, neighbors, and local communities to be aware and advocate for themselves, their children or families, and their communities. We believe all people have value, deserve respect, should have their basic needs met, can learn and make a difference by serving others. We believe that true collaboration is the most important tool in accomplishing our mission. We say true collaboration because there are many people who enter into work that although it may be important work, it is perhaps best defined as being networking or partnership and not true collaboration. So in the work that we do, we want to support true collaboration when that is the mechanism that is needed in order to create the outcome that we desire. We value a systems approach. We value collaboration that has a collective impact. We value early childhood services as a way to impact the future of our state and our nation. We believe that change is constant. Therefore, we must constantly scan the environment for opportunities and challenges, and we must be nimble to respond thoughtfully and appropriately to those changes. We value using a wide range of data, so we want to use that data to understand the current reality of the families and programs we serve so we can plan strategically, and also to use that data to tell a story of our success with credibility at national, state, and local levels. With that being said, who is KHSA? So here we are by the numbers. We are a statewide membership association of our 29 Kansas Head Start and Early Head Start programs. And now, most recently, this also includes one of the Early Head Start Child Care Partnership grantees. And through our membership and the programs that are members of our association, we represent more than 2,500 staff, 10,500 children and their families, and then 19,000 volunteers, which includes about 11,500 parents. And then also more than 25,000 members of our Kansas Head Start community. So that includes other partners in other programs who also serve children and families prenatal through age 5. We were established in 1997, so we're currently 17 years old, and on November 25th, 2015, we will be celebrating our 18th birthday, so we are almost to adulthood. As I mentioned, we are the unified voice of Head Start in Kansas, which strengthens and supports our members through education and training. And that education and training most often is for staff at Head Start programs, but it also includes training for our parents. Mostly that's for advocacy work and financial literacy work. We also work to seek funding from grants and corporate partners, and then we engage in advocacy at the federal and state levels. And together, with all of our partners and all of our members, we are a powerful voice. And a very good example of our powerful voice is the sequester a couple years ago, when due to the Budget Reduction Act, Head Start, as well as many other programs, were going to experience, and did experience, a cut in our funding. However, due to our voice, our powerful voice here in Kansas and as well as at the national level, the sequester or cut was restored to Head Start due to some really great advocacy work from parents as well as programs and then state and regional associations. So when we say that we have a powerful voice, we are not just saying that. We know from experience that we do have a powerful voice, and it has an impact. We are part of a national network, so there we are, flashing there at the bottom. We have a National Head Start Association, which the Kansas Head Start Association is a member organization of. And then there are many regional Head Start associations as well throughout the United States. Our region is Region 7 Head Start Association, and the Kansas Head Start Association is a member of Region 7 Head Start Association. And then within our region, we have 4 states. So there's Iowa, Kansas, Missouri, and Nebraska. And each of those states has an association, and we all work together as part of a national network. So for membership, and the way that we do our work is that each program, whether they're a member of our association or not, may select up to 4 affiliate program members. We call those APMs. So that includes a director, a friend, which could be a community member, a business partner, somebody who is not meets one of the other categories, but is part of the program and is a supporter. Also includes a parent and a staff. And those people come to 3 meetings each year, which we call APM meetings. And those meetings occur in Salina, and they are normally during October, January, and April. At APMs, the APM meetings elect the 15-member board. So our board is composed of at least 9 affiliate program members, so APMs, those directors, friends, parents, and staff. But we may also elect up to 6 at-large members. In the past, those have been business partners, people from higher education, banking partners, people who are involved in state agencies or state work, especially child-serving agencies. Those sorts of key partners are also at-large members. So those APMs and others. As you can see from this chart, those all, the director, parents, friend, and staff from each of the programs make up our APM, our affiliate program members, and then they elect the KHSA Board of Directors. And then we have various committees and work groups that complete and are responsible for the work of the association. So we have some standing committees that are established by bylaws. So those include governance and leadership, and audit and financing, and then member services committees. And most of the time those are become part of the work of the board. However, we may also involve other KHSA members to be part of that work. And then most recently we have changed some of the committees that we have, and we now like to talk about those as being work groups rather than as committees, which oftentimes can be standing committees that we, from the past experience, have turned into committees that just meet because they are standing committees. So we, through our new strategic plan, have implemented 4 work groups, and I will talk more about those later on. So KHSA board members may serve 2 2-year terms, so that ends up being 4 consecutive years. And as a board member, they are responsible for developing, revising, and overseeing implementation of the strategic plan, approving all policy statements issued, approving the budget at least annually. However, we normally have new grant money and other changes due to changes in funding that require a review or a modification of the budget. So they are responsible for modifying the budget and approving that budget. Ensuring fiscal and legal integrity of the Head Start Association, and planning and carrying into operation such other measures they deem proper and expedient to promote the mission and the vision. So it is a large responsibility that board members hold. So the board meets 6 times a year, so usually every other month. 4 of those meetings are definitely face-to-face, and we normally end up having 2 meetings that are meetings by phone and using some sort of virtual online meeting so people can see documents and still have conversation by phone. Board members are expected to attend all meetings. However, if you are not able to attend, you must notify the KHSA Executive Director of your absence if you know you're going to miss a meeting. So please notify me by email or by phone. The board is led by the President, Vice President, which is the President-elect, Secretary, and Treasurer. So normally, the way that we have operated in the past is every year we have an election, and the board members vote for a new president. And that president, or president-elect, is the vice president, which then the next year moves into the president position. And then that president, who is outgoing, normally serves as an ex officio member on the board to help with transition for that president. As a new board member, you will review and sign a board member agreement if you have not already done so. So now let's go through what we do, kind of in a little bit more detail. So I talked about advocacy. So much of our advocacy has to do about education of policymakers and the community to influence policymakers about Head Start and our needs and issues that are important to us. We do work with our congressional delegation in Washington and with the governor and Kansas legislature. Much of the state work that we do, we work with various partners, but also at the national level we work with various partners to do our advocacy work. For professional development, But we work to educate staff, parents, and our partners on various topics. And then when it comes to leadership and other education, we have various special projects that we engage in. So we focus on priority needs within programs, especially as they relate to funding that is available for us to fund those activities. So in the past, those activities have included mental health, so early childhood mental health, financial literacy, oral health, and parent health literacy. So let's take a little bit of a closer look at the advocacy work that we do. So we do have strong relationships with our representatives and senators. There are a few that we have a stronger relationship than with others. However, I try to maintain monthly contact with each of our representatives, and then we also take an annual trip. We bring parents with us on that trip. So it becomes not just an advocacy opportunity, but an opportunity to develop and educate parents and develop their leadership skills as we take parents on Hill visits. We work towards positive changes to federal Head Start legislation, and then we work closely with partners and the governor on early education in Kansas. So an example of that is we do have about $9 million going to fund the Kansas Early Head Start program. Then there's also the Early Childhood Block Grant, which is around $22 million annually, and that is awarded through the Kansas Children's Cabinet and Trust Fund, which is funded by the Children's Initiative Fund, or CIF, which is funded through the Key Fund, which the money comes into the Key Fund from tobacco settlement payments each year. Another issue that we're interested in is the Child Care Development Block Grant, and then other legislation that's going on. So for this past year, some of the things that we've worked on is making comments to the proposed rulemaking on the Head Start performance standards. And then we have been working with the National Head Start Association to get prepared for possible Head Start reauthorization of the Head Start Act, which has not happened since 2007. And so we want to make sure that we are prepared as a field to provide feedback if such an opportunity would present itself during any of the current or upcoming legislative sessions. Much of our work at the national level happens in cooperation with the National Head Start Association. And at the state level, we work with Kansas Action for Children and their Partnership for Early Success, which is a coalition of various partners that come together to look at issues that impact children age birth through 8 and their families here in Kansas. So let's take a closer look at the benefits of the Early Childhood Block Grant to Head Start and Early Head Start. And so this is specific to our project, which is the Early Learning Communities. It used to be called the Demonstration Learning Communities, so people may refer to it as the DLC, but now it's Early Learning Communities, or ELC. We do currently call it the Early Learning Communities models for Kansas preschool program. And so we've received various levels of funding throughout the years that we've been having this project, and we're currently in our 6th year. And we started in 3 communities: Coffeyville, Liberal, and Rossville, and now we've expanded to, we're in 13 different sites, which is in about 16 different communities, which includes school districts. And so our model is that we integrate preschool services among Head Start, school district, and and childcare. So usually within a classroom you have children who are eligible for Head Start, if not they are Head Start children, as well as state-funded pre-K or 4-year-old at risk, as well as special education. And then sometimes there's some children from the community that are included in that classroom. So we want to make sure that we meet the highest quality amongst all those programs that are in that classroom, so that everybody receives a high quality early childhood education. Our project coordinator is January Scott, and she has been on board with that project since it started. And she provides strategic planning and consultation for each of the sites that are implementing this model to make sure that, well, number one, it's a collaboration that includes the multiple partners, and she helps offer support for that by helping write a strategic plan, but also holding them accountable to implementing that strategic plan throughout the course of the year. So now let's take a look at our professional development. We are a major provider of training to Head Start staff and parents in the state. Obviously, each of the Head Start programs are ultimately responsible for providing training to their staff. However, we oftentimes try to provide training either regionally within the state or at state level to provide training that's more cost effective for programs when those opportunities present themselves. We also offer a statewide conference every 2 years, so that usually helps provide special workshops and those sorts of things for the Head Start community every 2 years. Our last statewide conference was in November of 2014, so a year ago. We also provide special trainings based on member needs, so we often are sending out surveys to member programs. And we also provide networking sessions to specialty groups. So those usually have included education coordinators, health coordinators, home visitors, family service workers, those sorts of groups. So they have time together to talk about topics that are specific to their roles within their Head Start programs. And Peggy Kelly, she is a contractor with the Kansas Head Start Association. She helps facilitate creation of agendas for those networking sessions and making sure that there's somebody who's responsible for facilitating those meetings and keeping them on track and on agenda. So this is a little bit more detail about our conference that we have every couple of years, and it is focused on Head Start and early Head Start. So last year in 2014 we had a conference that was collaborating for quality, strengthening the conversation, and sometimes you might hear people referring to that as our joint conference. So that was a conference that was planned with Child Care Aware of Kansas. We are currently working on another joint conference, but we've reached out to other partners. Our vision for this is to create an annual conference for the majority of the early childhood field. So we are currently working with Child Care Aware Kansas, as well as the Kansas Parents as Teachers Association, and of course the Head Start Association, on a joint conference in May 2017. We have been talking with some other possible early childhood partners to be included from the ground level on this joint conference planning, and hope to know by the end of the month whether or not those groups will join us. But either way, we will still want to make sure that we provide learning opportunities for anybody working in Kansas in the early childhood field. We also offer special trainings. So we have a basic and advanced home visitation training, class, observation reliability training, Hoover's training, ERSI, and conscious discipline or challenging behaviors. So oftentimes we will reach out to obviously folks who are trained and experts in those topic areas to contract with them or work with them to be the trainers, and then the association helps run registration for those trainings and works on logistics to make sure everything runs smoothly. So we also provide grant projects based on programs' priority needs, and sometimes that has to be balanced out with available funding. So normally we are writing grants to solicit funds to meet the needs that are provided to us through surveys of grantees. So one of those projects is our Parent Health Literacy Project, our Parent Financial Literacy Project, Home Visitation Training, which is currently not funded by a grant. We are seeking funding for that. Mental health and oral health. So our Parent Health Literacy Project, our current project coordinator is Peggy Kelly. So about a year ago, the project coordinator was Debbie O'Neill, who was our first project coordinator for the Parent Health Literacy Project. And we were lucky to have Peggy Kelly take over this project as well. She's the project coordinator for some other projects here at the association. This project works at educating parents about caring for their children's minor illnesses and injuries at home. And so what we do is we train practitioners who work with parents and train them how to work with parents to understand how to use this book, which is called What to Do When Your Child Gets Sick. We have found that it results in a reduction in unnecessary ER and doctor visits. And currently we've been, actually over the past 3 years, we've been expanding our reach beyond Head Start into health departments, safety net clinics, congregations of faith, and we have developed video training for use in hospitals and other settings that helps provide explanation about the book and our project, so the trainers who we train do not have to spend as much time going through the book and providing instruction. So some sites find that that's useful and others do not, so the practitioners can decide, and we do have an evaluation using both models, and both models find a reduction in unnecessary emergency room and doctor visits. Our other project is Parent Financial Literacy Project. So this project started with funding from the Kansas Early Head Start programs. And most recently we have new funding from the Kansas Health Foundation to continue the project. Bank of the West also provided some funding to help us in areas where there is a branch of the Bank of the West. And then we have some pending applications that are still out there. The Parent Health Literacy Project is open to all Early Head Start and Head Start programs in Kansas. We are working at expanding to Head Start staff. In the past, since it was implemented using Early Head Start funding, we were working with only Early Head Start grantees, but now we have funding that lets us expand to all Head Start programs and staff. So project coordinator for this project is also Peggy Kelly. We started the project with focus groups with parents so they can help us to define what they need as we combed many resources to find curriculum that we could use for this project. We also conducted interviews with directors and other staff, and as a result, we have a list of various curricula and resources for programs to be able to use. However, we selected to use the Money Smart curriculum, which is published by the FDIC, and we have found that that curriculum can be modified, so there are various modules, and based on the needs of the parents, you can add or take out modules and still maintain the integrity of the curriculum as a whole. So we have selected to use that, and it's also free, so it's a free curriculum for programs to be able to use. So what Peggy Kelly does is she helps each Head Start program that wants to implement a project to identify a banking partner who then will work to put together a group of parents to then train at the local program. And often the financial literacy project is kicked off by some sort of a community event where various community members are invited to the Head Start program to kind of learn more about poverty and finances and how that impacts families and their community, to have a kickoff to the financial literacy project in their community. We have, over the course of the few years that we've implemented this project, collected data, and we've made some modifications to the project over the course of those couple years, and we continue to collect data to be able to make modifications as needed. Home visiting training has a couple components to it. So we have a basic home visitation training, and there is an online piece to that which needs to be completed first, which is followed up by a face-to-face 2.5-day training. And anybody can register for and take the online trainings. However, we offer 3 of the face-to-face trainings a year. Advanced training, advanced home visitation training has been offered about once a year for the past few years. We are currently working with our training provider to see if they're going to be available to provide that training this year. We also have home visiting coaching available. This was a project that got started when we had funding from SRS and or DCF, Department for Children and Families. However, that funding ended, and so the home visiting coaching is still available. However, if it's desired, then programs will need to pay the fee for the coach's time. And as I mentioned, DCF contract ended in June, and they did provide us notification that it will not be renewed, and so we are seeking funding to fund that without registration fees, but for now the training is funded by registration fees for each of the trainings that we plan. We have also done some early childhood mental health work. The United Methodist Health Ministry Fund funded us to take a look at what services are needed to support early childhood, and that we're looking at ages 0 to 8 due to the Medicaid definition of early childhood, which is 0 to 8, so prior to entering school, and also services that would need to be provided to the family in support of the child's social-emotional development. And then our vision was then to use those service definitions to be a starting point for a Medicaid state plan amendment, and then to advocate for the state to submit the SPA, or state plan amendment, for approval. We also wanted to work with various providers or perhaps the MCOs or managed care organizations to use existing funding to provide more services than what are currently being provided. And then also to work at capacity for providing early childhood services. So over the course of a little bit over a year, we have completed some of this work. So we definitely have a basis or a basic Medicaid state plan amendment, or at least the basic building blocks of that, in case the state political environment changed enough that we would be able to start working with state agency to submit that for approval. But currently we have started working on a new project around early childhood mental health messaging. So our goal is to use a survey which we have drafted with the help of Wichita State University Center for Community Support and Research to test various early childhood mental health messaging with various audiences. And once we test those, to then get those messages out to the field so they can use them, but then also to target our messaging and messages to various leaders to help educate them about the importance of early childhood mental health and investing early. We are currently putting together a proposal to help fund the early childhood messaging survey. Oral health, in the past we've had a lot of early childhood mental health work going on, but over the past few years there's been limited opportunities for funding for this specific issue. However, we do have what's called the Kansas Cavity Free Kids, and so that is, it's an initiative that's been going on for about 6 years, and its goal is to provide equipment, supplies, education, and technical assistance around early childhood mental health in the state of Kansas, so that kids are cavity-free and healthy and ready to learn. Currently, the Kansas Head Start Association is a sub-grantee through a DentaQuest grant, and Oral Health Kansas is the recipient of that grant. And Kathy Hunt, who is the project coordinator, is working at Oral Health Kansas. However, we get a portion of Kathy's time to help implement the KHSA portion of this grant. And so through this grant, we're providing training and other oral health resources, and then there's some research that is being conducted as well to help us get some more information about the prevalence of cavities in our population, our Head Start population of kids throughout the state. We have just completed a new strategic plan, which the plan started in October of 2015. And we have various focus areas. There are various focus areas that have to do with advocacy. And so those areas include communication, parent training and support activities, and then other education and training activities that are not specific to parent training and support. We have always had a focus area around advocacy, but we wanted to split those into these 3 different areas so we can focus our energy. And in the past, we've not had a specific focus area around communication, which definitely came out during our strategic planning process, that it was important for the association to focus on our communication internally with our members, and then also externally with partners and other people who may not even know what Head Start is and what Head Start does. We added a focus area this year around marketing and public awareness, and the reason that that was being added was because of our communication, wanting to make sure we improve the way that we communicate with the public about Head Start and what we do and what it is and the impact that Head Start has on the families as well as the community and the state and the nation. We still have a focus area around education. And so there are various activities under that as they relate to financial literacy and parent health literacy, as well as other areas. We also have a focused area on leadership, and so we wanted to make sure that we are intentional about our activities around that during this strategic plan. And so one of the first activities that we're doing is bringing the Head Start community to create a work plan to take a look at leadership and exactly what are we trying to do through these activities and who. So are we targeting parents, are we targeting staff, or both? And finally, we want to make sure that we are diversifying our funding basically to improve our sustainability as an association. So our plea, our ask to each board member, including new board members, is to join a work group. So Peggy Kelly and I sat down and reviewed the strategic plan and what we want to accomplish through the strategic plan over the next few quarters, and we identified some tasks which need to be completed by various work groups. So we have 4 work groups that we have established. So there's other work going on, however, we need to have work groups implement these pieces of the strategic plan while Peggy and I and other contractors and staff will be implementing the other pieces of the strategic plan. So communication and marketing is one of the areas where we have a work group, and the tasks for that work group are around pulling together tools and resources for programs and others to use when they are communicating or marketing Head Start. There are 2 work groups around advocacy. One is about parent network and training. And so we are certainly wanting that work group to be made up primarily of parents to inform our networking and training for parents over the course of the next 3 years. The next piece is around advocacy, so we specifically wanted to focus on voter registration and voting. So that group is going to be looking at resources for programs, parents, and staff, and also for KHSA to create a marketing plan around voter registration to encourage people to get registered if they're not, and then also to be informed about who is running and also the issues so that when they go to vote, they will be well informed and be able to make a decision based on the information that they have available. And then finally, leadership development. So we really want a work group that will take a look at and advise the beginning stages of what we have been calling a leadership academy. And so some of the first questions that need to be answered is, what do we want to accomplish through the leadership academy, and who are we wanting to target? So is it parents, staff, or both? So I did want to take a quick look at what are our expected outcomes from the strategic plan. One of the outcomes we want to achieve is that the Head Start community actively engages and participates in KHSA's activities, projects, and initiatives. And so the work groups are certainly one way to do that, as well as serving on the board. The Kansas Early Childhood Care and Education community works together to leverage resources and opportunities to respond to its needs. Early learning programs that positively impact Kansas children and families receive an increased investment of resources. We know at this point that this outcome is probably a little lofty given our state and the challenges that we have around revenues and budget. So it is perhaps our goal to focus more on maintaining current investments than increasing. Those investments, however, if we don't have a vision for increased investment, then we won't be working towards that. So we still want to make sure that the work that we do focuses on ultimately increasing the investment of those resources. The Kansas early learning community experiences increased personal and professional growth and development. So that is one of the reasons why we focus so heavily on professional development, education, and leadership. An expanded and diverse funding base supports the Kansas Head Start Association mission. So that's where the diversified funding focused area in our strategic plan took form, and definitely wanting to focus on sustainability of the association. And then local communities are well informed and equipped to educate their community and representatives, as well as advocate for quality early childhood care and education. So this outcome is definitely has a wider scope than just Head Start, which we believe is important because Head Start is a very effective model and a very effective programs. However, we are not the only early childhood care and education programs in the state, and we have other awesome partners that do great work. And so we want to make sure that we are all working together to meet the needs of all Kansas children and their families. So that is the end of this presentation. And so if you're wanting to learn more, please check out our website by going to www.ksheadstart.org. You can also contact myself, Eric Vaughn, the Executive Director. We also have an office manager. Her name is Karen Berchoux, and a new fiscal manager, Claudia Kressig. We are also available by phone at 785-856-3132 or by fax at 785-856-3134. Thank you for taking time to listen to this. And if you do have questions, please email us or give us a call. Thank you.